Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a great guest on with us, Soheil Saadat. He is the founder and CEO of GenieMD. Soheil, welcome to the program.
Good morning, Tom. It's great to be with you.
Awesome. Soheil, it was very interesting to read the press release yesterday in regards to Frost & Sullivan recognizing you, obviously, as the technology innovation leader in the North American virtual care market. So congratulations for that recognition.
Thank you. Yes, we were humbled and appreciative of Frost & Sullivan's research, independent research that evaluated a number of platforms and companies, and we're very pleased that we were awarded this recognition.
And for folks that don't know about Frost & Sullivan and this award criteria, there's two basic categories that they look at. One is technology leverage, and the other one is business impact. Under technology leverage, they look at commitment of innovation, commitment of creativity, stage gate efficiency, commercialization success, and application diversity. Under business impact, they looked at financial performance, customer acquisition, operational efficiency, potential growth, and human capital. So again, with those criteria and looking across the market and the competition that you're up against, certainly the recognition is an awesome one, and with everything considered. So congrats again. I know you've been on the program before. Let's start off by telling us a little bit, remind the audience about who GenieMD is and your virtual care platform, Continuum.
Sure. Thank you, Tom. Yeah, so we started a good number of years back. GenieMD is kind of approaching 10 years of being in business. So we were one of the early adopters of mobile technologies in providing basically a doctor in your pocket type of a solution. Early on, we started by providing a personal health record and a mobile device, a whole bunch of educational material, medication adherence, keeping track of individual vitals. And albeit that at the very beginning of this, the adoption was low. It was a challenge to kind of get individuals to use technology to take care of their health. But over the years, we have kind of pivoted from just one person taking care of their own health using a mobile device to participating or getting the family members and neighbors and others to participate in the person's health, to all the way to eventually pivoting into telehealth, telemedicine that we are now entirely focused on. So that's just been our kind of journey through the digital health world.
Awesome. And then there's also a GenieMD medical group. Tell us a little bit about that and how it relates to GenieMD.
Yeah, so when you're practicing medicine using telemedicine, there is, of course, a prohibition against the corporate practice of medicine. So GenieMD is, and like many other telehealth companies, is comprised of two companies. You have the GenieMD Corp and you have the GenieMD Medical Group. And we have a so-called friendly relationship in that we are their only customer. We provide them with technology, accounting, marketing, and other types of services. But GenieMD Medical Group is entirely an independent company, has its own president, and when they practice medicine, they are not under the influence of the corp or any other entity. So they can, the doctors within GenieMD Medical Group, albeit that they are permanently working for GenieMD Medical Group, or they are so-called Uber doctors that they come and go on the platform on an as-needed basis. We also offer a variety of specialties within GenieMD Medical Group, from primary care to optometry, ophthalmology, to allergy, immunology, rheumatology, neurology, and other types of specialties.
Interesting. So let me get back to the Frost and Sullivan report. I want to call out a couple of things that they note here. First, from a program perspective, people often think, why the virtual shift? And Frost and Sullivan calls out, and I'm just going to read from the report, virtual care revenue in the United States alone is forecasted to grow at a compound annual growth rate of 40.4%. From 28.63 billion in 2019 to 218 billion in 2025, emerging as the next significant growth opportunity across the healthcare space. That is one heck of a growth curve, and I see GenieMD right smack in the middle of it, certainly influencing change in the market. One of the quotes that I want to call out as well from the report says, Continuum underscores GenieMD's commitment to providing continuous care from episodic and remote monitoring services. The platform integrates telehealth and several engagement modalities with remote patient monitoring, remote therapeutic monitoring, and chronic care management, allowing providers to extend care from the hospital brick and mortar settings to the patient's home.
Yep.
That is quite a differentiated position. We often hear about telehealth, and you and I have spoken many times before. We know this market isn't about telehealth per se. Telehealth typically considered a video encounter, a virtual care looking at the broader spectrum. As I noted, Continuum is referenced as inclusive of all the above. Tell us a little bit more about Continuum and the aggregate of all the different feature functions within it.
Yeah. So the platform that we have designed, there are a number of things that are a given, right? You're cloud-based, you're mobile first, you're HIPAA compliant, you're secure, scalable. Those things are all given in any of these platforms. But what is unique about our approach is that we have created this virtual world, if you will. In this virtual world, we have a number of services that facilitate connecting the participants in healthcare. And who are those participants? You have patients, you have doctors, you have laboratories, you have prescribers, pharmacies, you have pharmaceutical companies. All of these players have certain experience within this platform. And that experience could be web-based, could be mobile. They can communicate via text, video, audio, exchange data. Data is securely stored. And as a result of this kind of operating system, if you will, or the platform that we have designed, we have the ability to now develop applications that are unique and address a specific and targeted market in healthcare. To just give you an example, recently we were approached by a large client, and that given the condition situation we have with COVID, they wanted to do COVID testing. And in a matter of 2 weeks, we were able to develop a comprehensive COVID testing application that sits on top of this platform, where patients come in, they run a test, they take a picture of the test, it goes to a proctor. Proctor can actually monitor the patient doing this, and then eventually the data goes into this cloud platform and is visible to the employers. So that's just one example of how this platform is designed. Now, as it pertains to continuum of care, you have these episodic cases, a sort of an urgent care type, where I have a simple sinus infection and I can come in and get a script, to more high acuity encounters where the doctor will really benefit by knowing what my blood pressure is and what my SpO2 is, etc., to make a better decision on my condition. And so to that end, we integrate with a whole bunch of smart devices. These are Bluetooth devices, 4G devices. So we kind of go from urgent care to primary care, but then that is still 20% through the story. At the end of the long day, people would like to stay home. They like to be monitored at home. They like to be taken care of home. It is safer to be at home and be taken care of. It is better to be in a preventative mode of taking care of an elderly that has a chronic condition, as opposed to after a certain event that requires going to the ED. So as a result of that, we have developed a comprehensive remote patient monitoring, remote therapeutic monitoring, and chronic care management platform that sits on top of this platform. So a patient that comes in one day for an urgent care encounter can eventually seamlessly within this platform be a person that we are monitoring, whether it's monitoring because of a chronic disease or monitoring in thinking about preventative medicine. If you're pre-diabetic, what are the things that we can help you with and guide you to exercise and manage your diet to don't fall the cliff of becoming a diabetic. So that's basically the vision behind Continuum, in that you go from a low acuity encounter all the way to us monitoring you, to all the way to suggesting how you can have a better lifestyle to live the healthiest life possible.
Interesting. So, oftentimes when technology comes along, and I'll use EHRs as the example, and I know it might not be a good one, but, it came along and it tried to replicate what was already being done in the paper world. And EHRs, obviously, many dings they get relative to the inefficiencies that they brought to the market, but it also had some benefits. So I'll leave that there. But fast forward to Continuum, it looks like GenieMD is definitely enhancing the model in the context of urgent care, primary care. Being able to do that in a virtual setting is certainly progress, and it certainly opens up accessibility to care. But providing continuous care changes the model, and the fact that you have such a robust platform to do that, in my view, continuous care is the first time that healthcare can realize an accelerated path to a value-based care model, because it's not what happens when you're in the office. What happens when you're at home is just as important, and that continuous care and the ability to extend into the home is critical. Thoughts on that?
I agree 100%. It is, we go to a doctor 2 or 3 times a year, and we are there for 30 minutes, 20 minutes. The doctor is evaluating us based on very limited set of data points. I walk in, they measure my instantaneous blood pressure and my weight, and the doctor is going to make a decision as to what I should be doing. That's just really no good way of taking care of a person's health. It's the ability to monitor a person's for their vitals over a period of time, see how for example, if the person is on some type of medication, are they taking their medication? Is the medication helping with the particular vital that is trying to control, and bringing insights into the interaction of the medication and the vital, for example, as a simple example, is something that will bring insights into the physicians kind of coming up with a better care plan for the individual, as opposed to just a very episodic, very short encounter that is really not designed to take care of you. It's just designed to address a particular specific problem. But when we go home, there are just the rest of the minutes in a year, and that no one is monitoring you and nobody is looking at you, and that is where the focus is in trying to help these individuals live a better and healthier life.
If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley, and we're speaking to a special guest today, Soheil Saadat, who is the founder and CEO of GenieMD, who was a recent award winner of Frost & Sullivan's Technology Innovation Leadership Award. So, when you look at the robustness of your platform, it's not a virtual care platform. It's telehealth, it's remote patient monitoring, remote therapeutic monitoring, chronic care management, and more. You start with device integration and EHR integration and lab integration and above. The old argument was, the whole alert fatigue from a physician and things of that nature. And, I'm not getting compensated to provide care in the home. Again, it's that whole payment model which was an inhibitor in and of itself to innovation. So now there is, I would say, no excuse in that a provider can extend care into the home, provide that continuous care model, and be compensated through the payers for that service. So there's opportunities for one, growth from a practice perspective, and equally important is that there's a greater opportunity for that patient to not only get on that awareness, as they get on that awareness continuum, to move towards that state of wellness more with greater level of success than they might have had in the past. Thoughts on that?
Yeah, no, that is a very important point, in that at the end of the long day, if these health encounters are not compensated, there are really no incentives for the doctors or to participate. Now, one of the beauties of remote patient monitoring, and I'm even more excited about remote therapeutic monitoring, is that the doctors get compensated through a number of CPT codes, and often they really don't have to do anything. It's just you go to a practice, you identify the chronically ill patients, you use the doctor's NPI to do the billing, and you can also ourselves or through partners or a health system on their own, they can offer the service of monitoring these patients. So the doctor is not sitting there on a daily basis monitoring 200, 500 patients' alerts. That is taken care of by us or by our partners. And then on occasion, when the doctor's attention is needed, then you ping them and you kind of get them involved. But in the process, A, the patient is being monitored, the patient is going to be safer at home, and B, and there are CPT codes that compensate the doctors and provide financial resources for companies such as us to provide those services. So I believe that what CMS has done, it's just really been fantastic in providing or making it easier for companies like us, for the doctors, and for the patients to benefit from the innovations in technology.
We couldn't agree more. So tell us, what is the, just shifting a little bit here, tell us about the market that GenieMD is targeting.
So we have a number of different kind of tracks in our marketing activity. Obviously, one of the largest segment of our market is to provide a private branded version of our platform to anybody that wants to do telehealth, telemedicine, remote patient monitoring, and they don't want to basically go through the millions of dollars that is needed to reinvent the wheel. We also spend some significant amount of time and effort and have established partnerships with pharmaceutical companies, either directly or through middle layer partners, marketing partners. And through those partnerships, a pharmaceutical company could be sending us a patient. And of course, once that patient leaves the pharmaceutical marketing properties, they completely detach for legal reasons, and they come to us. Our doctors see those patients blindly and they treat them. And that is actually a great way of promoting a pharmaceutical therapeutics. And of course, patients will benefit from getting those prescriptions, as opposed to, at times you watch TV commercials and they talk about a particular medication and the call to action is ask your doctor about. Well, here it's as soon as you see that particular medicine or therapeutic and you think that might be of benefit to you. For example, if I have dry eye and I go to some website and I see some medication that sounds really good for my particular disease condition, right there and then I can push a button and see an optometrist. And of course, the optometrist will prescribe me whatever is best for my condition, but yet we kind of get that traffic. We also have a direct-to-consumer offering. We promote telehealth, telemedicine services. And of course, as you and I mentioned, the remote patient monitoring and remote therapeutic monitoring is a fast-growing market where we can do that either directly or through partners and monitor patients remotely.
Awesome. So what's coming next for GenieMD?
That's a very interesting question, Tom. I think there are really two things that come to mind. One is obviously we are offering a virtual platform, and substantially any and all of the things that we're going to do is focused on virtuality of care here. But I also see that we will be kind of getting more and more involved in seeing the patient at home, whether we send an MA or a nurse to someone's home, because at the end of the long day, there are certain things that you can't do virtually, right? If a patient is prescribed an injectable medicine, you can't do that virtually. And there are many people that are reluctant to kind of stick a needle in their arm. So the ability of kind of getting closer to the patient in certain modalities is an area of great interest to us. The other area that is very exciting is the use of human genome and the genetics as it pertains to preventative medicine. For example, the 15% of the cancers are hereditary, and the ability to identify a patient with the possibility of cancer and offering tests and lifestyle changes such that that person, A, is monitored for that type of cancer, and B, the person can modify their lifestyle to the extent that it will impact the possibility of developing that cancer, is very exciting to us. And we are working with a number of partners that could facilitate this wonderful, exciting mission. So those would be the two things that I think would be on our radar as very important things to do this year.
Awesome. Very interesting, Soheil. So vision, where do you think, just putting GenieMD aside, looking at the market, certainly there's a lot of growth anticipated. Where do you see the market going?
So as you mentioned, Tom, in 2022 and of course beyond, telehealth, telemedicine, remote patient monitoring are about to take off in a very significant way. And we are really poised to be an important player in this market and take advantage of the growth. We have the technology, we have the medical group, we have partnerships that will allow us to be a very significant player in the virtual care market.
Interesting. We only have a few moments left. I'll hand it over to you. Any closing comments? What would you like to see occur in the market relative to maybe even regulatory changes and things of that nature? Any thoughts on that front?
Yeah. So of course we are innovators. Many other companies in this market are innovating, disrupting the old-fashioned way of taking care of patients. But what our hopes are is that also the people that are designing and defining the regulation in healthcare are also paying attention to the changes and disruption that is happening. I mean, I've said this many times before. A doctor that is licensed in California should be able to treat a person in Nevada right across the street and not be hindered by all this paperwork and the cost and expense of getting additional licenses. Many of these doctors that are just about to retire or retiring are at the peak of their profession. And a doctor is retiring in Massachusetts, and now he has to go through this onerous process of getting licenses in all these other states for no good medical reason, right? It's just all of the paperwork and all of the other aspects of the regulatory that is prohibitive. So that's one aspect of regulation that is just really not to my liking. And I understand safety, I understand regulations, et cetera, but there has to be a change in this area. And we saw that during the pandemic, that many of these regulations loosened up. And we saw the taking off of the utilization of telehealth. The other thing is affordability of care. So even when a patient has insurance, a telehealth company, or for that matter, anybody practicing medicine, you have to go through this significant, onerous, and expensive process to credential each and every one of your physicians against each and every one of the insurance companies, and at times the same insurance companies in different states. And somehow this has to change, because our ability not only to offer virtual care, but also make it affordable. So if a person has insurance, they can use their insurance, and it is not too onerous on the part of the innovators, would be, in my opinion, something that will significantly enhance affordability of care.
I would agree. Oftentimes regulations in and of itself are the inhibitors to innovation, and knocking down some walls in the context of 50 independent states when healthcare could be viewed by some as a ubiquitous, not to underserve that field, but it's a common practice on how it's executed across all 50. So why have 50 different regulatory constraints that a provider needs to get to, especially when patients themselves traverse many states. I myself, coming from New Jersey, have sought healthcare in 3 different states: New York, New Jersey, and Pennsylvania, and it becomes challenging on many different fronts. So I would agree with your points there, Soheil. We are unfortunately out of time. I want to thank you for your time and joining us on this program. And I wish you happy holidays and a prosperous new year.
Thank you, Tom. Same. Happy holidays and happy new year to you and the listeners. Thank you for including me in your interview today.
I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.